The Foundation's mission is to create programs, enhance and strengthen programs of the hospital through a community of donors such as grant funders, private organizations, service organizations, and other businesses as well. And part of the history of the mission of the hospital starts with our Franciscan sisters. And they tell a story about going down in the gold mines, trying to get donors motivated to start building hospitals to bring healthcare to poor communities and communities that needed the help. And so they extracted the Native American tribes for protection against the elements as they camped out overnight to try to seek out donors for funding for healthcare.
We recognized that we needed assistance in moving patients, and we were able to get hover mats through a grant from CHI, and we would not have been able to get those if we had not received that grant. The hover mats basically work like kind of a reverse air hockey. We put the patient on them while they're on the cart or the bed. We attach a pump that pumps air into it. The air then comes out the bottom, and they just float on a layer of air as we move them over, making it safe for them and safe for us. Having the hover mats has really made a big change in the number of work-related injuries we've had, especially back and shoulder. It makes it easier for us to move patients across from carts to beds and tables to carts, things like that.
We had a processor that was getting into the end stages of life, so we knew that as a group we needed to go forward with obtaining CR imaging. With the Foundation's grant, we were able to purchase the CR reader, which is what converts the images into a digital format so that they can be easily manipulated. What I have behind me is a total knee replacement. And so as you can see, there's a front view and a side view of the knee. Our surgeons are able to template the joints prior to surgery to make sure that we have the proper implant size for that surgery. We're now able to remotely view images. So not only do we see them here at Little Falls Orthopedics, we don't have to have them in our hands to be able to view them. They're digitally imaged within our Epic system now too. So when we're in the patient chart, it's a one-stop shop.
We had the same retro furniture that was here in the 70s as we had in the millennium. For me, the excitement was when the Foundation and the Auxiliary came up with money for me. It was a reality that we had been working on for about 17 years and was able to put that into play with the furniture, the carpeting, the redecorating, and the resetup of the cafeteria, which has benefited not only the patients, but the employees of the organization as well.
Prescription drug abuse prevention is important because it affects the whole community. People get addicted to these medications, sometimes through innocent injuries or reasons for being on these medications, but then they get addicted long term. All these medications in the community then can get to other people who don't need them. People sell them, people abuse them. Our young people are getting addicted to them, and it's just becoming a big issue.
In the last 6 months, about 20% roughly of the number of pills that we were previously prescribing have been taken off the street, basically because we know that the patients that we have been getting these medications from are now not selling them. Our hope is that this grant money is not just going to help our community, but basically all the communities kind of around us.
The Drug Free Communities Grant Project is focused on reducing substance use among the youth in Little Falls, and two of the substances that we're focusing on are prescription drugs and marijuana. A third substance is also alcohol. There are several things that make this project unique, but one thing definitely is the strong collaboration that we have with the hospital, with law enforcement, and with the pharmacy. The Prescription Drug Task Force has been a very strong resource for the coalition. We have several coalition members that are part of the task force. It's an awesome way for us to connect with the people who are very passionate about prescription drug abuse and preventing it.
A hospital in a community is probably one of the most vital organizations that can be available. We are very, very fortunate here in Little Falls to have a hospital that is expanding. and is growing and looking towards the future. It's not just sitting back on laurels or sitting back about worrying about how we can get the money. We actually go forward, and that is being accomplished through the foundation, council, and also, of course, with the advisory board of the hospital itself.
The healing ministry continues
because of you.
Thank you
for your support.
We love
our donors.